the prospect of a cure, a treatment for COVID-19. I'm going to go live now to Clive Palmer, joins me on the Gold Coast. Clive Palmer, thanks so much for your time. Your Palmer Foundation has donated, well, it is set to donate millions for the acquisition of 1 million courses of hydroxychloroquine. For those viewers who aren't familiar with the developments on this front, can you fill us in?
Yes, well, actually, what we're trying to do at the moment, I donated $1 million to the trial for hydroxychloroquine being held in Australia through the Royal Brisbane Hospital. And once I did that, it was very clear that that trial wouldn't be finished until about June. And by that time, we could have a lot of people in a lot of problems. So what we decided to do was to make the leap now and to try to acquire 1 million doses for Australians that could be made available to them for free, because nobody knows where we'll be in 3 or 4 months' time. And we've seen in Jordan, where it's now the official treatment for the virus, and we've seen it also in the United States, where President Trump is reeling it out, and it's having tremendous effect. There have been trials of it in China, which has worked with over 100 patients, and in France there was a very, very successful result where the drug was shown to eliminate the virus within 3 days for 50% of people, and to eliminate the virus in 6 days for 70% of people. So we need to look at a treatment. A vaccine is not a treatment, it's a preventive measure. It won't be available till middle next year. There'll be a lot of Australians that may need the treatment this year, and I want to make sure that there's drugs available for Australians when the time comes.
And this, as you said, you're funding a million treatments, or a million courses of this, some 30 million doses of the drug, and you will donate it to the National Health Stockpile.
Certainly, and that's just the beginning. Whatever it takes to make sure Australians get treated if they are sick, if they are in danger of dying, they get the best treatment in the world, is what I'm interested in doing. It's got no limit. You know, the Financial Review last Saturday said I was worth $9 billion. Well, I'm happy to pledge all of that if it's required to save our fellow citizens.
Now, talk us through, you've got, as you said, that arrangement with the Royal Brisbane and Women's Hospital. Professor David Patterson, he's suggested that this particular drug, he said it's not an overstatement to say it's a cure, and obviously you're feeling very confident about that ahead of the trials. Is the aim basically to say as soon as it's cleared, the drug supply will be ready to go?
That's what we're trying to do, and we've now got people all over the world trying to access it. We've got also we're looking at trying to get companies in Australia to be able to produce it. We can't produce it domestically. We should be able to. So I've got funds available to invest in any sort of facilities or resources that are necessary to bring to this country to make sure we have a long-term supply, because it's not just this year, it could be next year and the year after. So we've got to be prepared for these things, and I think we've got to take action now. We just can't stand around and wait for the bureaucracy or other people to do things. I think we've got to take the initiative.
And what are you hearing in terms of the timing here? You said mid-year, by the time the tests are done, the trials are done. What's your sense of where things are at? How soon can we get this out and Australians being treated with it?
Well, I think it's up to the government to decide when it can be introduced, but we want to make sure the stockpile's there, the drugs are available. In the United States now, we know President Trump is making that available in New York. He's got over 50 million doses going to American patients for treatment, and we've seen on the internet how that's been very successful. It saved lives in New York, and there's nothing else that will save people's lives. And if we consider the numbers that could be affected here in the long term, we have to do something. All Australians, regardless of their means and wealth, should have access to this treatment and should be given the opportunity to protect themselves and their families.
Well, Clive Palmer, we congratulate you on this very worthy initiative. Thanks for your time today as well.
It's a pleasure. All the best. Thank you.